Hi everyone, a warm welcome to our speakers and our audience on the YouTube Live. Thank you for joining our live event, and please don't forget to subscribe to our channel. Likes and shares are really highly appreciated. My name's Kim, I'm a project coordinator at Air Dialogue, and I'll be your host tonight. I'd like to start with a short introduction of our organisation. Air Dialogue was established in Dublin in 2010 to advance social cohesion by connecting communities, empowering people to engage, and contributing to the development of ideas on dialogue and community building. Air Dialogue aims to facilitate dialogue on a whole range of social issues, regardless of any particular faith or religion. It stands for democracy, human rights, equality, and freedom of speech. Today's panel will focus on the sociological impacts of COVID-19 on the nonprofit sector in Ireland. This panel will discuss the changes brought by the pandemic, the current difficulties faced by nonprofit organisations, and the possible solutions for them to recover. The COVID-19 pandemic is proving devastating to nonprofit organisations across Ireland. The key services to provide to Ireland's communities have never been more vital, yet organisations are facing limited resources and collapsing fundraising streams as they strive to deliver. For some, the crisis is challenging not only their reach, but their very existence. With this, I would like to give the mic to Lisa-Nicole Dunne, who is the Managing Director and founder of Mantra Strategy. She is also the chairperson at Charities Institute Ireland. I'll hand it over to you there, Lisa.
Thank you very much, Kim, and thank you for having me here. It's really lovely to be here and to offer my thoughts on the topic, which is something very close to my heart, the kind of impact that nonprofits can have. And obviously now it's a bit coloured by COVID, but I'm going to kind of come at this from, obviously we all have our own story and our own kind of impact from COVID. Mantra Strategy has a number of clients who are nonprofits, social enterprises and charities. And I'm going to talk about some of their experiences, but also then, you know, just from a Charities Institute Ireland point of view, I would have good sense of what's going on. There are so many issues at play. I'm going to focus on 4. Of course, there are many more, but I suppose the big issues at play, and you've talked about them in your introduction there. The first for me is the fact that we are now in a situation where, you know, the numbers of charities who are being impacted by a massive surge in the need for their services, that is, you know, hugely noticeable. So for example, you have a massive increase in calls to helplines. You have more people experiencing food insecurity, major increases in anxiety and mental health challenges. And I think then, you know, we're only starting to see the full impact of some of these school programs, which are more needed than ever, but weren't viable for a while. And then you've got employment access affected by COVID, and charities and services, our frontline health services also, but charities really being unable to physically attend to as many people. This is all just the tip of the iceberg. And I suppose what this leads to for nonprofits is, you know, they know that down the line now there's going to be this pipeline of even more increasing need for complex wraparound services at a time when they're also dealing with potentially way less funds. And I'll talk about that in a while. Just a couple of examples of what I'm talking about, I suppose charities such as I Am, the National Charity for Autism in Ireland was just inundated with support queries from families about educational supports, rights, and the needs of the autism community. And that's going to rumble on and have an impact for a very long time. The rent crisis, obviously, we know is going to build a massive pipeline of people who need housing and homelessness supports. And it's affecting student welfare, which is going to have a mental health impact for a long time. And I suppose it's going to take time to unpack the full impact of that. I'm not offering many solutions to that just yet, but I suppose it's just to be aware how much we depend on charities. And Charities Institute Ireland always says this: charities are part of our social fabric and they do so much, and we probably don't even realize how much they do. And now we're asking them to do more with less. The second key issue for me when we're talking about the impact of COVID is around how services are delivered. So some causes deliver programs in person. These are often really specialist programs that work best in person. If you take, for example, one of my clients is Suicide or Survive, And they have this Eden program, which runs over 6 months. And it's a program, it's incredibly delicate, as is, implied in the name. It's about pausing on feelings of hopelessness and going on a journey with people and clinically expert facilitators who are in a room and trying to help people really find connection and purpose again. And this has always been run in person. And obviously COVID has massively impacted this. Similarly, Grow Mental Health and other programs and services, they help people recover through community engagement on health issues. It's usually drop-in service, meetings in person. So they've had to pivot, I hate the word, but they've had to pivot and run their services online. And that's great. In some ways, it's opened up new audiences to the services. However, it does mean there are others who just will not work really as well they'll do much better in person. And then there are others who just simply do not have the access. So it's widened the digital divide. What if you didn't have a computer, or you really need help and you don't even know how to properly use the computer? So that's been a major thing. And then, the other thing is, like schools, some services and charities are really well placed to see risk of domestic violence or abuse. And if our frontline services and social services and schools and all of that, which are all charities as well, if they're not seeing as many people, more people are falling through the cracks. One client of mine, Dress for Success Dublin, who are now called Work Equal, they had to adapt how they delivered their services in a very practical way, I suppose. People couldn't come in and have, in-person workshops and styling and so on. But that's okay. They managed to do that online as much as they can. But equally, again, it highlighted the digital divide, the lack of computer access, Wi-Fi, or decent skills for remote access. And not only that, because a lot of their clients were trying to get back into workplace and have an opportunity to be financially and, economically independent, suddenly, because of the burden, and I use that word lightly because we all love minding our kids, but the unequal distribution maybe of childcare in the home meant that many women who were using their services had to rethink whether they had the capacity to work again, given the impact of COVID and homeschooling and everything else. So that's number two. The third issue then really is funding. And this is obviously, my background is in fundraising and commercial and funding. So we have really seen this change. So Irish Charities has estimated that they will be down, for more than 400 million in last year because of the impact on fundraising. But the charity landscape is so different. So some charities are so small and so volunteer-led, and then some are really large, multi-layered organizations. And the impacts of funding really vary by subsector. So it depends how long the charity exists. It depends, what sort of fundraising portfolio they have. So charities dependent, let's say, on street or church gate collections, on community fundraising, on events, they would have initially seen their funding totally decimated. And some charities, that's all they do to raise money. So that means they were put at risk of being kind of wiped out. And I think the real impact will be seen this year, And so I know your intro mentioned digital, and digital fundraising has had a real heyday. In particular, Facebook and I Donate, they had some real successes and surge in support. And so much funding has been raised this way. And it's worth saying, pre-COVID, we were told actually about 15 years ago that direct mail was dead for fundraising purposes and digital was the way forward. But honestly, prior to COVID, no money really en masse was being made online. So this is quite remarkable. And I hope that some of this stays. But the question remains, how long will it be before people tire of it? Like, can they keep sponsoring, the different challenges and everything people are taking on? It's amazing to see people respond in this way. But how do we maintain momentum, I suppose? And every charity is also trying this now. So, that means it's very crowded, it's very competitive. That means you have to advertise more, which increase costs. And I suppose that's another challenge. From a funding perspective, People have really responded incredibly to radio appeals, to the Late Late Show, for example, and this is vital to charities. But there are other challenges. People have thought to support local, and that impacts NGOs who are absolutely supporting the most vulnerable around the world, not just Ireland. And I suppose we really need to have more connection to helping, right around the world and showing that empathy. Trust and foundations, a lot of the time, they were really focusing only on COVID. That affected funding for charities as well. And it makes it very competitive as well. Everybody's applying for the same pool of money and funding. So really, I think one of the solutions here is we really do need those who can support to dig deep. And we need those who are in a much better position to really kind of do strategic funding and giving. And then just on company fundraising, I suppose just companies have faced their own uncertainties, and that has a bearing. A lot of them haven't rotated their charities, so they aren't giving as much. Some have done really great work, but the wonderful opportunity that CSR offers for employee engagement, that can't be realized in the same way because we're not all together. We're not all in the workplace. We're working remotely. And I think that's a real shame. And I think I'd love to see companies really see that charities can solve that problem of bringing people, who might be despondent or feeling disconnected together. Charities will find alternative ways to do this for them, and CSR can actually help them really retain and engage staff. Last couple of points for me, really, I suppose public can really support charities, not just in terms of giving money and volunteering, but really in trying to understand the role they play, the critical importance they play in our lives every day. There is a lack of trust. Often we're dealing with that. People can be quick to focus on the one bad story over all the good that charities do. And that makes it very hard for charities to recruit and keep amazing people. And they need them. They need paid and volunteers to really do the incredible work they do. So it's a cyclical kind of chain of events that further drives a wedge in trust if it's more expensive to raise funding, and the funding is crucial. So I'd love, actually, my kind of call out is that if people can support charities by believing they're incredible and that they are, for the most part, absolutely good, and understand the value they bring, that would be really helpful. Because that just leads me to my last point, which is the Great Resignation. So we have seen people leaving jobs now because we've all evaluated, what are we doing? I mean, I was personally sitting on the M50 for a long time, one of our big motorways here. So people are now leaving jobs because they've said, okay, maybe I want to do something that I'm more passionate about. Maybe I want more time at home and so on. So charities were already experiencing problems with recruitment and retention. And often you're hiring somebody who's highly skilled, dealing with major social challenge, but we're not paying them the same as the corporate equivalent, or we're not paying them the HSE equivalent or whatever, public funding isn't matched either. So they do it for the love or the passion or the vocation. And now they can't see the impact they're making as much because we're all a bit more removed. We're not in there, you're not seeing it. And so, and volunteers, the nature of volunteers is changing as well. It's harder to induct staff and volunteers. It's harder to secure them. Nearly every one of my clients is looking for new volunteers, both at grassroots level and at board level. And I think that that's the other major issue we're going to see is that, charities depend on volunteers and staff. And really it's very shifting sands. So they're kind of my 4 initial things that I think I'd like to put out there for us to discuss. But obviously we're all coming from very different perspectives. So I'm really interested to hear the rest of the panel too. Thank you.
Thanks so much for your insights, Lisa, and that of your clients as well. It was really, really interesting to listen to. I'm going to move it on now to our second speaker, Dr. Avril Kennan. She's the CEO of Health Research Charities Ireland. I'll hand it over to you there, Avril.
Thanks so much, and thank you, Lisa. That was it just really resonated with me in so many ways. We're coming from very different perspectives, as you said, but I might pick up on some of the things you said as I talk through my piece. So Yeah, so I'm the CEO of Health Research Charities Ireland. So we're an umbrella organisation for about 40 charities. And the thing that they all have in common is that they're trying to improve lives through research. And, I think over the pandemic, the value of research has become really, really apparent to us all. So I think we always have a sense of it. And, the truth is that anytime you go to the doctor, what you're prescribed or the information you're given is almost definitely based on previous research. And the truth is that many of us wouldn't be here today without that research. But then through the pandemic, we saw it happening live almost in front of our eyes. And in particular, in terms of the vaccine, where we were waiting for this thing and hearing updates on how development was going, and then getting it in our arms and seeing the positive benefits of that. So the charities that we represent are all focused on research. You know a lot of them. There were the big cancer ones like Irish Cancer Society and Cystic Fibrosis Ireland and Fighting Blindness, and then all the way down to tiny voluntary led charities, often in rare diseases, usually parents of a child with a rare disease who are just desperate to get some research to help their child. And the types of research that they support in various ways are very varied. So it's the kind of treatments and cures stuff, like the gene therapies that comes out of a lab, things like that, for sure. But it's also sociological research. For example, the mental health of older people through the pandemic, or the role that carers have played and the extra pressures on carers in recent times. So and everything in between. And our role as the umbrella organization is to, number one, support them in everything to do with research. And part of that support is really creating a community. And we've got a lovely tight-knit community of charities, actually, and they support each other. And then we run what we call the joint funding scheme. That's a scheme whereby charities can get matched funding for the research that they want to fund. Through the Health Research Board in Ireland. So it's a really, really valuable thing for them. And then we also run what we call the Irish Health Research Forum. Don't worry about the names. But this is where we bring together all the stakeholders. So our member organizations and the communities they represent, together with the researchers and the policymakers and anybody who is in a research support role, and sometimes even politicians and journalists, bring everybody together to address the big issues and to try and make health research in Ireland better in order to ultimately improve lives. So our members have been sort of, everything Lisa-Nicole said, we can relate to that. But then there's been some particular things for them as well on top of it. So they represent clinically vulnerable groups. Often many of our members are patient organizations, and they're representing these groups, for example, with lung conditions that were clinically vulnerable to COVID. And they had to deal with that onslaught of fear really at the start of the pandemic, and had to try and provide leadership at a time when none of us had the answers and nobody knew who was going to be most affected by this horrendous virus. And they've been doing that ever since. And a lot of our members represent people with rare diseases as well. About a third of our members either particularly represent patients with rare diseases or fund research into rare diseases in some way. And for those people, there are particular issues because no more than in the condition they have itself, where there's not enough research done and not enough understanding of the condition, nobody knew how COVID was going to affect them, and still don't to a large extent, although we're slowly getting there. So one of the things that we did through this period is at the end of last year, we did a survey of our members to see how they were being impacted particularly. And I'm not an expert in fundraising, and we don't support them in fundraising, but we did ask them in that survey how their fundraising had been impacted. And 3/4 of them reported an income reduction of 20 to 60%, with most of them sitting in the 20 to 40% bracket of income reduction. And, as we've heard, they've had to change how they do fundraising in so many different ways. And it's been really, really difficult. And it depends on the type of charity, the extent to which the extent of the impact on them. So for larger ones who could pivot, to use that term, they did get online pretty quickly and they were able to make things work, and they still took a hit. But for smaller ones that just don't have the resources to suddenly change how they do everything, it's been really quite extreme. They also reported that there were, for 70% of them reported that there were delays to research that they're funding. So, when you think about it, one of their main reasons, and sometimes their only reason for existence, is to fund research, and they're trying to fund this research and make things happen. And then they're having these huge delays and sometimes cancellations of projects. So that was really, really difficult for them to deal with. They also reported that there was a very strongly negative impact on research more generally, beyond what they were funding themselves, and particularly that the patients that they represent weren't getting to take part in clinical research because they just couldn't attend the clinic. And in some cases, the researchers couldn't even get access to their labs. And, there were so many things that happened, particularly in the early days. We're getting better at that now, but hugely detrimental. And some people have lost the opportunity to participate in clinical trials that may have had benefit for their health. And then, of course, there was a really detrimental impact on running research events. So one of the things that we really see as a strength of our members is they have this very strong ability to bring together all the stakeholders in research, so the clinical people and the research themselves and the patients, and bring them all together at these events to push things forward. And of course, there was a negative impact to that as well. And then on top of it, there were, what we saw through the economic crash in 2008 was that what happens when things get tough is that there's a shift from research to patient care, because patient care is more immediate and the needs are so strong. But actually, when that happens, is you're impacting future patient care, because that's how it's the research that gets us to better care in the future. And we saw, that first week when everybody started working from home, we were running an event that week just before the schools closed, and we just had massive drop off that week because there was this panic where everybody had shifted into patient care needs in some way. And then there's the other things that, Lisa-Nicole mentioned as well, like the fact that it's a female-dominated profession. And we ourselves, as a charity that is completely female-led, have felt that very much. And of course, there's the fact that the salaries tend to be quite small, so people don't necessarily have an office to work from home in. And the offices that they do have for their work are often small and cramped and weren't suitable for working during COVID. And there's still, I would say, because of the nature of these charities, there's still a real cautiousness about the risk. And I think particularly this week, we're all feeling it again, and so many events have got pulled again. I think certainly in my community, and I've no doubt for everybody listening as well, it's felt this week like we need to dig deep again for resilience, and it's hard. And so, that cautiousness because of the clinical vulnerability still exists. But somehow they have carried on doing amazing things through this difficult time. So they've worked with their research collaborators in all sorts of ways to keep research moving, and done things like giving them no-cost extensions to the research that they're funding with them. So in general, they haven't been able to afford to put additional money in, but they have been able to work with them to restructure and give them more time to keep projects on the road. They've also moved a lot of activities online, of course, including what we call patient and public involvement. So that's something that's a very big focus for us. And it's about not just patients and members of the public participating in the research itself, but actually getting to decide what that research is and how that research should be run and what's meaningful in their lives. So ourselves and our members have a big focus on that, and they've had to shift a lot of that online as well. And it's really, really difficult. And again, there's that digital divide that we really have to think carefully about. But on the plus side, it's given them an extended reach beyond what they've had before. And they've been able to involve more people, increase the diversity of the people that they involve. So that has been a positive. And then maybe for us, the greatest example of pushing through difficult times has been, I mentioned at the start, we run this joint funding scheme where in this case, the charities determine what research they want to fund, what's relevant to their communities, what's most likely to lead to impact. And then they go through this process with the Health Research Board. And at the end of it, the projects are co-funded by the charity and the Health Research Board. And somehow we have more charities participating in that scheme this year than we ever have had before. And I'm still not quite sure why that is, but I guess it's a way for them to still fund research because they can get that matched funding and they're being creative and they're being innovative. So there's so much more we could talk about, but I'll leave it at there for now, and I'll pass back to you, Kim.
Thanks so much, Dr. Avril. It was a really, really interesting perspective and made some really great points as well. I'll introduce our third speaker now, Gerard Reilly. He's the Senior Statistician, Head of Income, Consumption and Wealth Division at Central Statistics Office, Ireland. I'll let you go ahead there, Gerard.
Thanks, Kim. Basically, my presentation is going to focus on the impact that the COVID-19 crisis has had on well-being. So I've got some slides, and Kim is going to go through them with me. So basically, Kim, if you can just skip to slide number 3 there. Thanks. So in effect, in April 2020, the CSO decided to run these social impact of COVID-19 surveys. We ran 5 of them between April 2020 and February 2021. And I guess each survey had a particular theme based on what we thought was confronting persons in Ireland at the particular time. And as I go through the presentation, maybe that will become apparent. But in most of the 5 surveys, we asked questions pertaining to well-being. There were 3 questions looking at overall or satisfaction ratings with particular dimensions to a person's life. So these questions asked on a scale of 0, where 0 is not at all satisfied, to 10, where 10 is completely satisfied. How satisfied are you with your life overall these days? So we asked that in respect of overall life satisfaction, satisfaction with the financial situation of one's household, and also satisfaction in relation to personal relationships. So when we analysed the results, we did it in 2 ways. We took a mean score. So a mean score is just literally adding up all the scores and then dividing it by the number of respondents. But we also categorised the scores into a low satisfaction rating. So if somebody, for example case, said that their score or gave a score of 2 for their overall life satisfaction, well, then we classified that as a low satisfaction rating. So 0 to 5 was low, 6 to 8 is medium. And then if somebody gave a score of 9 to 10, 9 or 10, well, then it's a high satisfaction rating. So next slide, Kim, please. So in addition to these kind of overall life satisfaction, overall satisfaction with personal relationships and financial satisfaction, we also asked persons in relation to the 4-week period immediately preceding the interview date, whether they felt downhearted or depressed or lonely. And the answer options there were 5. It was this 5-point scale, which went from none of the time in the last 4 weeks to all of the time in the last 4 weeks. So next slide, Kim, please. So as I said, it was in April 2020 we ran the first survey. So I decided that because I'd noticed certain things maybe in my home life or because of my own changes in behaviour, that there might have been a lot going on in relation to consumption behaviour, in that people who smoked, who worked in an office, who couldn't smoke in an office, were home. Are they smoking more? Are people eating more junk food? Are people consuming more television, internet consumption, and also alcohol consumption? So in the middle of that infographic, you can see the statistics in relation to changes in those behaviours. So we had 22% of persons increase alcohol consumption, with 45% with an increase in junk food or sweet consumption. What we found really interesting is that female respondents were far more likely to report increases in consumption in relation to alcohol, also smoking, and also junk food in comparison with male respondents. What I found surprising, we had the question in, but I didn't expect the results to be so dramatic. If you look at the left side of that panel, we had 12.2% in April 2020 rated their overall life satisfaction as high. So they gave a score of 9 or 10. But we actually had those questions in the SILK survey, which is the survey on income and living conditions. We had it in 2013. And 2013, an awful lot of households were experiencing the effects of the financial crisis. And we had 31.4% of persons in 2013 rated their overall life satisfaction as high. That increased in 2018 when we had a relative financial boom. And then it actually decreased to 12.2% in April 2020, which surprised me. It also surprised me in relation to the drop in the percentage who rated their satisfaction with personal relationships as high. It dropped from 60% in 2018 to 42.4%. When we actually analysed that data, it wasn't in couples. The satisfaction rating was actually quite high in couples. It was actually in younger persons. And these younger persons obviously were they were in lockdown. Their social life was decimated. And that was the group that was actually pushing this major decrease in high satisfaction ratings with personal relationships. We also found that at that time, there were people who were very concerned about stress from household confinement. So we had 17% of our respondents saying that they were very concerned about stress from household confinement. And we also found a higher percentage reported feeling lonely or than we had previously seen in other surveys. Next slide, please, Kim. So that's just basically when we're looking at the respondents in relation to age grouping, because we actually found quite different results dependent on the age of the respondent. So if we go back to 2018, when things were going great in the country, and if you looked at the percentage of respondents in 2018 who rated their overall life satisfaction as high, 48% of those who were 18 to 34, so nearly 1 in every 2 or 5 in 10 said it was high, and that dropped to 10% in April 2020. And that was the biggest decrease. So when it came to kind of these well-being scores, we kind of found that with elderly respondents, even though the scores were worsening, they weren't as dramatically reduced as it was in the case of younger age group. And I think what we found over the 5 rounds of the survey, that the groups that tended to be impacted most were younger, but also females. So next slide, please. So that was the April, and we ran the survey again in June, and I won't spend much time on this because there wasn't really a well-being focus on it. And if you remember back to June, there was a lot of discussion about kind of easing restrictions, and there was a lot on the radio about, 1 meter versus 2 meter social distancing and whatever. So that was the focus of the survey. So basically, we just asked people in relation to their comfort levels, and you can see what it was there. So I don't think we need to spend any more time on that one. So next slide, please. We decided in June that based on the huge increases in consumption behavior in relation to junk food, we asked respondents, in April we found this, we asked respondents in June if their weight had increased or decreased since the onset of the pandemic. And we had 40% of persons actually said their weight increased. But we actually asked respondents for their weight and their height. So we actually calculated their body mass index, and we tried to work out overweight and obesity rates. And if you look at statistics in Ireland in relation to overweight and obesity, you will find that men, I think, there's something like maybe 8 percentage points higher than females in relation to overweight and obesity rates. But we actually found in this that the gap narrowed significantly between males and females, and that the overweight and obesity rates at that stage had increased. Then we'd asked stuff which has nothing got to do with well-being, is in relation to kind of financial situation of the household, whether people were saving because people weren't spending, and then what they were going to do with their savings. So it's kind of home improvements, garden furnishings, savings, future holidays, that sort of stuff. Next slide, please, Kim. I think for me, this is probably one of the more interesting ones. In August, we ran a survey and we kind of focused on the impact of school closures on children because there was a lot of debate in relation to, I'm not saying debate, but discussion, would schools be able to provide a safe environment in relation to kids going back to school? But we asked parents who had children in primary or secondary school whether they believed that school closure had an impact on the child's learning. But we also asked in relation to the social development of the children. I found it surprising myself. You know, I have kids. I expected that when it came to primary school kids, that parents would say, yes, definitely there was an impact on the social development of the child. But we also found it with secondary school kids. And we actually asked, but our sample size or achieved sample size wasn't big enough. But we asked in relation to secondary school kids what class they were in. And we found that when it came to TY years, that there was a bigger impact on the lack or the impact on the social development. And I guess maybe that reinforces probably the importance of that year in relation to social development of kids. If you look at the right-hand side of that panel, we asked parents if their child was worried about having fallen behind, bearing in mind that everybody wasn't going to school. And we'd more than 1 in 3 parents saying that their child, if there was a secondary school child, that the child himself was worried about falling behind because of school closures. Next slide, please. So, not to be accused of focusing always on the negative, we asked in November, which was the next time we ran the survey, whether there was any positive impacts on the COVID crisis. So we nearly 3 out of every 10 said that there was, and they reported the fact that they're spending more quality time with the people they live with. Workers, 20% who said that there was a positive aspect, identified that spending less time commuting. But then on the right-hand side of that panel, which we didn't really expect, we found a big increase when we compared the results from the April survey in the percentage of people who reported feeling downhearted or depressed all or most of the time in the 4-week period prior to interview. So in April, 5.5% of respondents said they felt downhearted or depressed, and that increased to 11.5%. And when it came to loneliness, it went from 6.8% in April up to 13.7% in the November survey. Next slide, please. Don't have to spend much time on this, but in November, they introduced the traffic light system. So we asked respondents what their views were on people coming in from red, orange, or green regions. Interestingly, we found, and even though we had an awful lot with very good reporting of compliance with government guidelines and restrictions, but 21% of respondents said that they were unlikely to comply with restrictions if it prevented them seeing friends during the Christmas. And then we asked about worries in relation to Christmas. And you see there, 41.9% of persons were worried about household confinement, being stuck in the house with obviously family or friends, family mostly, because I guess friends aren't allowed into the household during the Christmas period if restrictions were in place. Next slide, please. So February was the last one. So we decided we'd revisit in relation to the impact of, because we had a second school closure in January, February. And these are the results. In the August one, I showed you the results as related to the percentage of parents who said moderate or major impact, negative impact. This is just purely focusing on major negative impact of school closures on learning. So when it came to learning, more than 1 in 3 parents with a child in secondary school said that it had a major negative impact. But when it came to social development, 1 in 3, 33.6% said it had a major negative impact on the social development of the child, which was actually higher than a parent with a child in primary school, where it was only 1 in 5. Then we looked at maybe the impact of school closures on working parents. So what did parents do when the kids were at home in effect and weren't going to school? So the impact for those who are working, 23.2% worked disjointed hours, 12.3% actually were working in the office but came to working from home, and 1 in 10 reduced their working hours. So next slide, please. So this we'd asked, and it was the first time we asked in relation to an explicit question, because we'd measured well-being, but we never mentioned the word COVID-19. It's just, you tell us about, on a scale of 0 to 10, you know, how satisfied are you with your life these days? But this was the first time we asked, well, do you believe that the COVID-19 pandemic negatively affected your mental health or well-being? And we'd 74.4% of 18 to 34-year-olds said that it negatively affected their mental well-being, whereas it was only 32.4% of those who were 70 and over, which in effect reinforces what I had said earlier, that it seemed to be the younger persons that were more negatively affected when it came to well-being. So the next slides, which kind of sum up, and it's kind of a time series. So this looks at from 2013 to February 2021, looking at the mean overall life satisfaction scores by the reference periods. So 2013, it was 7.5 when we were experiencing the effects of the financial crisis. Score increased in 2018, dropped to 6.5% in 2020. Got a bit better in August, but society had kind of opened up at that stage, and then dropped again in November with a further drop in February 2021. Next slide, please. This is the percentage who reported a score of 0 to 5, which we classified as low overall life satisfaction. So back in 2013, it was around 15%, and it dropped to under 10% in 18. Then big spike up to 30%, dropped in August when society had reopened, and went up to over 40% in February 2021. Next slide, please. And then this is the same in relation to feeling downhearted or depressed all or most of the time by the overdose, that reference period. So not going into the statistic for each reference period, you can see the trend there. So just maybe highlight one, it was around 3% in 2018, and it went up to 15% in 2021, February. Next slide, please. And then this is feeling lonely all or most of the time. Back in 2018, it was less than 4% of respondents said that they felt lonely all or most of the time, and it went up to around 13% in February 2021. Next slide, please. So this last couple of slides I have is just looking at well-being indicators, firstly by sex. And as I said earlier, that women seemed to have been more negatively impacted than men. So the orange bar is the score for females, and the blue being for men. So basically, almost not far off 50% of women reported an overall life satisfaction score of between 0 and 5 in February 2021, compared with approximately 33% of men. Nearly over 60% of women said that the COVID crisis has affected their mental health or well-being negatively, and that was just over 50% of men. And then big difference when it comes to the feeling lonely, with around 18% of women reported feeling lonely all or most of the time in the 4 week prior to the date of interview, compared with around 9% of men. And next one, please. And then this is it by age group. So you can see the 18 to 34-year-olds are represented in blue, those 70 and over are represented in orange. And just, I mean, it speaks for itself. So if you just look at the feeling lonely, we had almost 20% of 18 to 34-year-olds, and we had whatever small percentage of 70 and over that said that they felt lonely. And we kind of found that surprising with certain surveys where the over 70s were advised to cocoon, that even though they were, that the impact of loneliness seemed to be more impactful on the younger cohort. And I think that's it from me.
Thanks so much for the talk, Gerard. It was really, really insightful. Very, very interesting as well. So if any of the speakers have any questions or comments for each other, you can please go ahead.
I might ask one of Gerard, if that's okay. That was really fascinating, and I think so much of what we felt over the last year and a half is there in hard evidence, which was good to see in a way. And I'm wondering, do you think we're having enough discussion about the social impact of COVID? I personally, just as a person reading the news, and I feel like we've sort of slipped right back into the clinical effects of COVID, and the slight talks of lockdowns, restrictions, and without enough talk about the social impact. Is that your sense as well, or no?
I'm not sure in one respect, because I guess, like, my job is a statistician, but we put the information out there. But when we put that information out there, it got huge coverage each time we did. So when we put the November out, it was actually Micheál Martin commented on those results in relation to lifting restrictions for Christmas. So they are being used by whatever decision makers in relation to kind of looking at the mood of the country in relation to the impact of the COVID crisis on well-being. I guess in one respect, we did the last one in February 2021, but just resources in my division, because we've an awful lot of other stuff to do, we would have loved to have done more. And we hopefully will be able to do one in 2022, because this will be a year later since our last one. But I suppose in one respect that there is a fatigue in relation to, do you know what I mean? I guess there's a fatigue in relation to these statistics as well. Like, I mean, the first publication, you come out with it and it's kind of, oh, look at what COVID has done to loneliness and whatever. And then we're coming into nearly 2 years later, and it's nearly so hot, we feel it ourselves. So yeah, but I don't think,
Gerard, sorry, yeah. I was just going to come in on that and say, I think there's no doubt that I've actually read lots of the research you've been putting out along the way. And I think at the time you publish, it's picked up. But I think, to Avril's point, I'm actually not sure if it's getting enough airtime and discussion in real terms, in terms of actually, when we look at the stats you're talking about, the 74% of that 18 to 34-year-old group, or when we think about we're at our most miserable ever, that 5.8, I mean, they're astounding facts. And the reality is you're doing everything you can to push them out. There's no question about that. But I think when I was talking about, we have 5 or 6 different mental health organizations that we work with. They are all really, really seeing the impact, and they know how significantly this is going to impact health over time. And yet I'm not sure that's being fully taken on board when decisions are being made. I still think some decisions, certainly last year around your research, if it's top of mind at the time they're back in making those decisions, definitely. But I mean, I really worry that this kind of current fear that's raising again, because the numbers are on the up, I really do worry that actually we're not weighing up the full impact of another lockdown on that social and mental, kind of psychosocial piece for young people particularly. But actually, I'm in my 40s and I'm really struggling with the idea of another kind of, difficult Christmas. So yeah, I think your work is invaluable in the conversation, but I'd love to see more forums where we are getting to talk about that, because I think we're going to be picking up the pieces from this for a long time. And I know we're here to talk about solutions, Kim, so I'm sure you'll want to open it up now to talk more about what can we do. But just to kind of say, I think, Avril, it's a point really well made. And how do we do that? How do we keep the conversation going and put the right solutions in for this especially younger people? I mean, 10%, that's really, really, really scary stats, I think,
Yeah.
As Lisa there said, if anyone has any insights into solutions or ways to move forward, please go ahead, share your thoughts there.
I mean, I'll kick us off if you want, guys, and then I suppose there's a couple of things for me. I mean, we're talking to hopefully a very mixed group of people who would be engaged with our dialogue and watching today. So I suppose my message to people as individuals would be, to believe and trust and find a way to engage with charities, and whether that's to support them financially or be champions, or just, connect and champion causes and share. Like, it doesn't all have to be about money, but equally, if they can volunteer, if they can, you know, share skills, or if they can fundraise, brilliant. For charities, I suppose, or, you know, various groups that'll be on here, one of my messages is sustainability is a really important topic. Like, how will they survive and thrive into the future? And I suppose I would encourage them to consider alliances and ways to work together. And I think, Avril, your umbrella group is a great example of how when organizations do come together and share, it can be really fruitful. But equally, they can share services, they can share campaigns and outreach, and they can work together on things. And we do a lot of work in that space, and I think it's definitely worth doing. I would love to also suggest one solution is, you know, to beware a little bit of kind of colloquialism and really think broader. And I think that's what you guys are all about. So, and then just to be kind, I suppose that my big worry, not just from this talk or Gerard's stats, but I mean, it's a real worry based on the work I do as well, is that, you know, we need to bring hope back for young people, and we need to bring hope back for us all. And I think charities can play a really, really important role in doing that, because you feel good when you get involved with the charity. You feel good when you get involved with fundraising. You feel good if you're participating in research. You know, it is actually a really good and important part of how we can feel good about ourselves and contribute to a better society. So just that everyone thinks about, you know, using the opportunity to get out, even if it is being active through doing something for a charity or volunteering in some way. I think it's part of the solution as well to us feeling hope again.
Thank you so much, Lisa. Does anyone else have anything?
I might just pick up on something Lisa said. I mean, that they're just fantastic and very broad things that we can really do. There's you talked a little bit about connection and working together, and I am a bit concerned that for charities, but not just for charities, for everyone, that connection and that collaboration is really, really important. And we've been forced to do that in different ways, but we've also lost a lot of it, I think. And I'm worried with the trend to working from home and the overscheduling that's happening as well. I don't know how you're finding it, but I think people are a little burnt out at the moment. It's like event after event after event, and you're trying to make them all work, and there's no gaps in between. And then you're kind of half there. You know, you're on email as well as at the event. We can't do that now, but so there's this sort of loss of quality, I suppose, in connection. And I think we really need to think about that. And how do we make sure that we are getting that in-person time where you get the really valuable side conversations and the personal stuff? And how do we make sure that we do that while also the benefits of hybrid working, or whatever you want to call it? And then the other thing is online events. I think as we get better technologically with them, I think we're almost making them more impersonal. And how do we create spaces where we can, it's never quite the same, but how do we create spaces where we're actually having a conversation and that people feel that they are connecting? That's just another thing to think about, I think, and not to let the technology drive it. Let the human connection drive it.
Thank you so much. That was really, really insightful. I'll open it up to questions from the audience, if that's okay. We have a few already. Our first one's actually for you, Dr. Avril. In the recent years, how has health researching impacted the funding for charities? And have you noticed any trends in the development of your social care projects?
Yeah, so the most of our member organizations are fundraising to get money to do research, and you know, they're doing it in all the ways that Lisa-Nicole talked about. What we're hoping now is that people's greater understanding of the role of research in society is going to help them in their fundraising. activities. So I think that is probably one of the pluses that's going to come out of this. I mean, who would have believed we would all have been talking about vaccines in the way we talk about them now, and even the different brands of vaccines, and we all know the efficacy, and it's quite incredible actually, and I would not have believed that was possible. And so I think that there's a way for our member organizations to connect in with their supporters more, and that's the hope. And then I think our members have also become more creative about how they get value from research without the money bit as well. So when I worked in a patient organization called Deborah Ireland when the economic crash happened back in 2008. And I found myself in a really, really difficult position where I was just back from a second maternity leave. My job in that role was as research manager. And we were funding projects all over the world. And my job was to manage all that. And I came back after this maternity leave to a new CEO, a new chair of the board, a new financial controller, none of whom knew anything about what I did. And essentially there wasn't a role for me anymore because we weren't funding. All our fundraising had taken a dive and we weren't able to fund projects anymore. And so I had to become very creative very quickly and be valuable without money. And it was incredibly hard. I had so many sleepless nights about losing my job, and I wasn't in that kind of role that long. So it would have been really difficult to get another job. But it was the best training I ever got. And I think it's led me to this role where I am today, because I had to think differently, and I had to think about how do we get value for patients without just putting money into it? How do we get better at our communications? How do we get better at our partnerships? How do we make research more meaningful to their lives? All of those things. So I'm not sure that quite answers the question, but I think we're seeing that now again, and that we'll get better value for the money we do have.
Thank you so much. No, you answered the question really brilliantly there. Next, Lisa, what inspired and interested you to join the nonprofit sector, and how can we inspire people to volunteer?
Yeah, that's a great question. I joined the nonprofit sector in 2009, and it was right on the back of, honestly, having worked in a sector that wasn't a good fit for me. And I kind of was feeling like Avril's talking there about burnout and well-being. And I just was feeling a little bit disconnected and disengaged. And I'm quite entrepreneurial spirited, and, fundraising in the nonprofit sector is a really incredible career, because you get to be a little bit of everything. You get to do such wide variety. You get to create your own products. You are you're everything from the kind of product creation and how a company can engage with something. You get to be really, really creative and innovative. And I think, Avril, your point is really valid. We actually have to, in that sector, we actually have to really, craft and create and innovate and come up with things on a very shoestring budget. And therefore that forces you to think big, think partnerships, and be very creative. So I was inspired to join for those reasons. I had always wanted to work with overseas development. I took a role in UNICEF, and I worked for 10 years in charities in various roles, including in children's medical research and in Focus Ireland in homelessness as well. And it was amazing. And I'd love to say to people that, when you give to a charity, or when you volunteer for a charity, or when you work for a charity, you are absolutely getting to be part of solutions and change in the world that we're living in. And that's very fulfilling. And actually, I decided a couple of years ago that I was going to kind of not pigeonhole myself and change sector. And honestly, I lasted about 9 months, and then I ran back to working with charities and impact organizations, because you do generally just find it easier to get motivated, to get up in the morning and have a kind of purpose, because you're already helping in some way. Now I amn't doing it on the ground in the same way, but I would encourage, college graduates and people who are, literally even a bit disillusioned and thinking about the Great Resignation, not only volunteer, but think about a job in charity, because charities cannot run on volunteers alone. It needs both, and it needs professionals, and it needs people who can commit a lot of time to it. So volunteering and working in, I would encourage it.
Thanks so much. Next question, Gerard. How do you think the social well-being can improve according to the trends for the upcoming years?
Difficult question, and as a statistician, I don't forecast when I haven't got the data. I mean, I guess, all you can do is look historically and see. You see that, you know, when we looked at well-being, even though relative to where we are now, well-being scores in 2018 were better than they were in 2013. So, I mean, that would suggest to me that, you know, financial struggles obviously have, or not obviously, but have an impact on well-being. And then we see in 2018 when, you know, when there was more disposable income, that well-being scores raised accordingly, or they were higher accordingly. I guess, I mean, we have seen with the well-being scores, I mean, the one thing is we saw an improvement in August 2020 when society was reopened. Then, you know, when we go into lockdown, you see an associated decrease in well-being, and it just, I guess it depends when we get out of this cycle. It'd be interesting, as I said, we intend to do another one in 2022, and I guess the results of that will be dependent on where we are in relation to COVID cases and lockdown and whatever else, and that'll depend. That's what's going to, in my opinion, going to impact hugely on the well-being scores.
Thanks so much. So I'll just ask if anyone has any last thoughts to share before ending the panel.
I was just going to
first there.
Yeah, sorry. I was just going to say that question that you asked me there about volunteering, and I've also said about working in the sector. Just to say, Charities Institute Ireland website, it's well worth a look if people are thinking about jobs in the sector or a career in the sector. And there are other sites as well that are really worth the look, Charity Careers, etc. And then Volunteer Ireland is well worth looking at if people are looking for a voluntary role or board match, if they're looking for a board position. And the final thing I would say is that otherwise they can go directly to their favourite charity, their favourite cause. They're always looking for help, ideally in fundraising, but in many other ways as well, as drivers, as supporters, in so many ways. So just to encourage people, you know, we can all make a change and be part of it. So yeah, thanks.
Thanks so much, Lisa. Avril, do you want to go next?
Yeah, just to follow on from that, actually, I think this is similar but different. So I mentioned earlier on, one of the things we do is patient and public involvement in research, where people actually get a say in how you do it and what way it's done and so on. So if you can imagine going into hospital for a clinical trial, you might say, well, you know, you've said that I should visit the hospital 4 times a month, but there's no way I can do that. So then you would feed that in, and they might think about doing it differently in a way that would work for your life. Things like that. And one of the things I would say, I think we're making really good strides in that. But I think we're struggling a little bit with inclusion and diversity. I think we need to do better. And I noticed that you seem to have a very multicultural audience. You're really good at connecting people in our dialogue. And I just want to put it out there that if people would be interested in getting involved in something like that, because one of the things we know is too much research is done on, you know, the usual suspects, middle class, white people, usually men. You know, we need to broaden that out. And so if people are interested in getting involved in that way, maybe they would have a little look at our website. It's called Health Research Charities Ireland. And there's a list of member organizations there. And many of them are looking to build networks of people to be involved like that. Thanks.
Thanks so much, Avril. Gerard, if you have any last thoughts to add?
Yeah, it's just in relation to what Avril said there and research. The survey on income and living conditions, which we have responsibility for in the CSO, every year, I guess the reason for the survey is for measuring poverty rates, household and individual income, but we also have modules in that survey every year. And I think I can't remember what year, maybe 2023, we will have one on discrimination, access to services. And so there will be, we will be able to analyse by, you know, by gender, by age group, by disability status and whatever. So there's probably an awful lot of statistics that we have published that maybe aren't being utilized to the maximum in relation to, there's a lot of information, there's a lot of data there in relation to particular aspects of society, whether it comes to whatever the topic is, that could possibly be better utilized and answer some questions.
Thank you so much. So we'll end our panel here. I just want to say thank you so much to all of our panelists again. You've shared some great insights, and it's brilliant when people bring such passion to the topic as well. And thanks to everyone who joined and watched today. As a closing mark, please don't forget to subscribe to our YouTube channel to keep up to date with future events. Thank you so much.
Thank you so much.
Thanks so much.